Well, welcome everybody. We'll get started on time so that we can all get back to our evenings. I'd like to say good evening and welcome to tonight's webinar on the My Health Record and Electronic Referrals. Thank you for taking the time out of your evening this evening to join us. My name is Angela Heathcote and I'm from Eastern Melbourne PHN. Together with my colleagues Kirsty and Josie, we welcome our guest speakers tonight, Kathy Rainberg from Australian Digital Health Agency and Eric Dunn and his colleagues from SR Specialists and Referrals. Eastern Melbourne Primary Health Network is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. I'd like to begin by acknowledging the Wurundjeri people and other people of the Kulin Nation as the traditional owners of the land on which our work in the community takes place. We pay our respects to their elders, past, present, and emerging. Tonight, we'll be discussing initiatives such as My Health Record and electronic referrals and how these may assist you in your practice and care coordination. Before we begin tonight, just to let you know that we are all on mute. You can ask at any time questions by typing them in the chat box. For those questions not covered in the presentation, our guest speakers will be more than happy to answer these at the end of their presentations. Tonight's webinar is also being recorded and all attendees will receive an email with a copy of this recording, copy of the presentations and also any relevant resources from tonight. At the end of tonight's webinar, you'll receive a short survey, so I'll be very grateful if you could please take a minute just to answer these at the end. So without any further ado, I'd like to hand over to our first speaker for the night, Kathy Rainberg from the Digital Health Agency. Thanks, Kathy.
Thank you very much, Angela, and thanks for having me. My pleasure to be here this evening. As Angela's mentioned, my name's Kathy Rainberg and I'm from the Australian Digital Health Agency, and I'm going to be focusing primarily on My Health Record for specialists and how it can help you deliver better patient outcomes for your patients. So a bit of an overview of the presentation that I'll be going through. First of all, I'll give you a general overview of what My Health Record is and what it can do, some of the current statistics and some of the key information that's available through the system. We are doing a bit of a live demo, but I should point out that all the documents that I mentioned tonight are also available across a whole range of different other systems. So it's not just Genie specific. You can access them through other software if you're using conformance software. And if you don't have software, there's even another way that you can do that. I'll talk about that later on. So I'll give a little bit of a live demo of accessing some of that key information that might be particularly relevant to you as specialists, and also talk about the new functionality that's been built into some of the software, including Genie, which allows you to upload your specialist letters. I'll talk about how you can get connected, what you need to do to get through that process and point you towards some of our resources. And then, of course, time for questions. So the Australian Digital Health Agency has been tasked with working across the country to deliver our national digital health strategy for Australia. That strategy was co-designed with all states and territories, and we worked closely with a number of peak clinical bodies and primary health networks, such as Eastern Melbourne Primary Health Network, to deliver this roadmap and now to deliver the projects that underpin that roadmap. And My Health Record is just one component of that National Digital Health Strategy. I really do like this slide though, because the little comment under that pillar of My Health Record really sums up what My Health Record is all about. Having health information available wherever and whenever it is needed. And I'm sure that you working in specialist practice are aware how often that key information that you need isn't available at your fingertips, and how useful it would be if you could just click a button and get to that information. And that's really why My Health Record's been created, because we know that all the different health and computer systems don't necessarily talk to each other or share that information. This is a way of having that summary information available as it's needed. So that brings me to what My Health Record is. And I should point out that it is just a summary of an individual's key health information. It doesn't replace your existing medical records or how you keep track of your practice notes, but it provides you with an additional source of information and information that you may not have directly received. And as I said, it's just a summary of that information. So it's not a complete record. It doesn't have the complete information from that person's GP or from other sources, but it can have some really key information that you might not have directly to hand. It is also personally controlled in that the individual who owns their My Health record does have the opportunity, firstly, to choose whether or not to have a My Health record at all. The positive news in that space is that more and more people have been actually choosing to have one, even though we went through that stage where most people were automatically enrolled to have one. But there are also controls that individuals can put over their My Health record to either restrict the whole record to only those people who they share a code with, or also to only allow certain documents to be accessed. So you need to be aware of that as a clinician as well. The beauty of it, of course, is that it is part of a national system, so that wherever you are working across the health system, you can find that key information. And if you're seeing people from interstate, if they're able to travel interstate, that information is really useful for other clinicians to be able to access as well. I know quite a lot of you are joining from Victoria, and a lot of those patients who perhaps might be travelling up and escaping Victorian winter, going to Queensland, and they can have that information available when they go up there and perhaps hitch up their caravan and stay up there for a couple of months over winter. The beauty, of course, as well, is that it is accessible at all times, provided you have connection to the internet. And there are security protections in place to keep the information within My Health records safe. And that includes that the software that integrates and talks to My Health record has to go through some pretty stringent technical requirements to meet the specifications to be able to actually connect. And there are also digital security certificates that work in the background. So the good news is that we've been working closely with primary health networks, as I mentioned, and a great focus for them and the agency has been on getting a lot of the initial connections up and running to My Health records, so that when you go to look at it, you'll find some relevant clinical information in there, clinical content. The good news is that 99% of general practices have already registered and are using My Health record. 99% of pharmacies are registered, and you can see 99% of them have used it. And public hospitals use has grown significantly. 97% of public hospitals, and we're also working with private hospitals, are connected to the system. And the viewing by those clinicians in those hospitals has grown immensely as well. So if you are a specialist and you're working in a public hospital, you could look at how you can access the system through their hospital applications. And that means you can view a person's My Health record if you're working in a specialist clinic within a hospital as well. In terms of what's inside My Health record, there has been significant growth in the amount of information now flowing into the system, and that's continuing to grow and expand and also to change as we make adaptations to the system to enable other documents to come in. But as you can see here, there's over 537 million documents have already been uploaded into the system. So they're available now, including 213 clinical documents. So that includes things like hospital discharge summaries, pathology reports, radiology reports, and so on. I'll show you some of those documents when we go to the demo. This is just to give you a bit of a snapshot overview to sort of bring home the fact that there is that significant clinical content now available. So this screen gives you an overview of the current documents that can be found within a person's My Health record. And on the right-hand side, you can see a list of healthcare provider documents. So they're the ones that are uploaded by clinicians. And the key document there that probably is of interest to you is if a person has a shared health summary. That's a document that's uploaded by their general practitioner usually, or their main regular healthcare provider. And it provides a snapshot of that person's health status in time. So that can be a really useful document to give you a good overview of that patient's current conditions, medications, past medical history, allergies, and so on. That's all provided that that GP has uploaded that shared health summary, and we're encouraging them to do that and put that information in there. That's actually an active thing that they have to do to upload those documents, whereas a whole lot of the other documents on that right-hand side of the screen are actually default to send through the system once that service is connected. So for instance, the hospital discharge summaries are automatically going up into a person's My Health record once that discharge summary is finalised at the hospital end. provided that hospital is connected. Likewise with pathology reports, as long as that lab is connected to the system, then their results will default to go up unless there's a request not to send it up into my health record and so on. I won't go through that full list of provided documents. Most of those would probably be fairly self-explanatory to you, but if you do have any questions, please pop them in the chat pane. The other thing to point out is that individual patients or consumers can add information in their My Health record. That's always clearly indicated as patient-entered information, but it can include important things such as if they have a significant allergy, they can add that allergy information to make sure it's available wherever they go. Patients can also upload a copy of their advanced care plans if they have those in place. There's also information that flows through from Medicare or Services Australia, which includes information around MBS claims. So you can actually look up and see if certain items have been recently claimed. That can be useful if you're providing a service that has a Medicare cap. Also organ donor registers and, importantly at the moment, Australian Immunisation Register information. The other thing to point out is around the middle of this screen in the My Health Record logo, you can see a number of circles. They represent documents that are actually generated by the system to hopefully make your life easier to find the information that you need. I'm sure you can imagine with all these different types of documents, if you just had them in a full list, you'd have to be clicking on each one, opening it up to find the information and digging through to find the information you need. These system-generated overview documents are designed to make that much easier for you so you can quickly get to the information you're looking for and hopefully find that readily within their My Health record. So let's just jump into my live demo. This was going to be a demo. It is based on Genie, but I'll just move into this screen here. Hopefully you are all seeing that. Oh, it's logged me out. Just a moment. I'll have to log back in. Within the new version of Genie, there is a button which indicates that a person has a My Health record. If you've registered your organisation and it's all set up within your system, you'll see a little green icon. And when you click on that button, it will bring up a screen that looks like this. They're using what's called a middleware product, which actually opens what's called this HIPS user interface. So your screen will look a lot like this. As I said before, other softwares will look slightly different. They all have a slightly different look and feel, but we are running virtual classroom sessions. So if you are using a different clinical software and want to know how to find the documents within your system, then I encourage you to join one of those virtual classroom sessions to find out. But this is more to give you a taste of what you can find. So you can see here we've got this patient, our fictitious patient, I should point out, called Lane Buckley. We've landed on her patient summary health record overview page, and right at the top we can see she's got some COVID-19 vaccination information. So just clicking on this drop down here, we can see listed underneath, this is advising us that this information has been sourced from the immunisation register and she's had her 2 doses of the Pfizer vaccine. So that's good news if you were looking to provide some treatment to her and wanted to know if her vaccination status was up to date. Underneath this, you can see there are other drop downs where you can find documents, other documents that have been uploaded to her record since the last shared health summary, and also a link to the most recent shared health summary document. So you can click on those and as you wish. One of the key documents that I like to point out though is this one called the Medicines Overview. And if we click along these tabs, you can access a range of different information. This Medicines Overview, as I said, is system generated and brings together information from across that person's My Health record, making it quick and easy for you to find what you're looking for. So this is an overview screen and it has a navigation panel along the top here. The first section that always appears is the allergies and adverse reactions. As I said, these are all fictitious, so don't take too much notice of the detail underneath. But this tab appears. If we click on this, we can see those allergies and adverse reactions listed underneath with the substance, agent, and manifestation and the source documents where there are hyperlinks and possible links back to that source document. So straight away, if you didn't have that allergies information, that could be quite useful for you to be able to quickly see that. And if, as I said, the individual had added information, that would be clearly indicated as patient entered information here. Clicking across this navigation panel, we can see a list of medicines. So we can see the list here by medicine. This is by date order. You can also sort by active ingredient, and again, links back to the source documents as needed. The other nice thing about this medicines overview is that it gives you a direct link to the most recent shared health summary. So if we click on that, this will give you an idea of the information you can find in that shared health summary document. So you can see here, this has been uploaded by Lane's regular doctor. At the top, we have adverse reactions, then medications, and scrolling down if I can, sorry, my screen's a bit small, medical history, and the immunisations that have been provided at that particular practice. So that would not be her complete list of vaccinations as held in AIR necessarily. So if you perhaps have received a referral that isn't fully detailed, this can be a really useful document to be able to quickly find and get some further information. And finally, the last tab in this medicines view is the straight to the most recent discharge summary. So if the patient has been in hospital recently, you'll be able to find that discharge summary just clicking on that hyperlink, and you're straight there. You've got a copy of that discharge letter. So you don't have to be spending time chasing that if you didn't directly receive it. So that's the medicines overview screen. I think that's one of the really helpful go-to documents within My Health Record. There are a range of others, as you can see listed here. I'm sure that for you as specialists, you may be interested in perhaps seeing pathology results. Be aware when you click on this link, there are filters in play. So if you need to see earlier documents, and because this is our pretend patient, I know she's got some older documents, expanding that date range will then retrieve that information, and you can then see the tests that she's had recently. Click on the document button. And in this instance, the pathology report's attached as a hyperlink, clicking on there, and you've got the blood results straight in front of you. I know that's really small on your screen, but it's really just to give you the idea that you get that straight away. That's immediately available. The beauty, of course, with that is that any pathology requests that have been made for that patient are then available for you to see, regardless of whether you requested them initially or not. So if someone says, oh, I had a blood test a couple of weeks ago, but I can't remember what it was for, my GP made me do it, have a look in their My Health Record, and you could well see those blood results straight away in there. As I said, it is dependent on the pathology lab being connected and actually uploading their reports to My Health Record. We are working with more and more of those lab services to do that, and there is an extensive list on our website of those services that are connected and uploading those reports. The other thing to mention about those reports is if you are the original requester, as I said, you can check a box within your software to say, do not send to My Health Record if it's particularly sensitive information or if the patient requests that it isn't uploaded. But once it is uploaded, it's then available for any other healthcare provider who has access to My Health Record to also be able to see. It's immediately available once it's finalised and uploaded to healthcare providers. But for the individual who can log into their My Health Record and see that information, there is a 7-day delay before they can access and view that report. And that, of course, is to give you as the requesting clinician time to review that result and get back to the patient if needed. The only exception to that is COVID-19 results, which are now made immediately available because we realise that patients need to be able to see those straight away. Of course, that's only for path results that are sent through a lab. RATS tests results do not come in to My Health Record at this stage. And you can see here the other tabs along. I won't go through all of them this evening. As I said, we are running virtual classroom sessions, but that's just to give you a taste of the sorts of information that you can find quickly and easily by having access to My Health Record. I think one of the clinicians that I've worked with previously from Melbourne indicated that she often receives information or a referral for a patient, and she thinks, oh, I'll just have a look at their My Health record as well. And she always finds more information than what she's received in that referral. So it can be really, really useful in that respect. In terms of uploading your specialist letters, this is just some screenshots from Genie software, but as I said, there are other softwares that are building this functionality in. Most of them have built it so that when you create a letter, it's just a matter of that letter automatically going up into My Health record unless you indicate otherwise. So in this instance in Genie, there's just a checkbox here and it's saying send a copy to My Health record. So that can be unticked if you wish, but hopefully you realise the benefit of having it in My Health record for future, for other clinicians to be able to see, and also for the patient to be able to hopefully guide their self-management a bit. Once that letter is finalised and it's clicked as ready to send, then you create your letter as usual, you click save and it's automatically uploaded into My Health record, as well as sent to your requesting clinician as per usual practice, which is probably what Eric's going to talk about in a little while. And here's an example of the letter that's been uploaded. It's in a PDF format, depending on your software, again, as to how it looks as it gets uploaded, but you can have the option to have it uploaded as a PDF. So the big benefits of My Health record, as I have kept saying throughout this presentation, is of course ensuring that you have quick and easy access to key health information that hasn't been directly received. Less time and administrative burden for you and your team gathering key patient information, but also saving your business time in terms of having to send information out to others. So if you've uploaded a copy of your letter, instead of your practice manager or support team having to find it, produce another copy and send it, it can just be, you can suggest that they check the person's My Health record. And of course, what it's all ultimately about is improving clinical decision making by making sure you've got that key clinical information ready to hand when you need it. And of course, avoiding undertaking duplication of tests and scans that don't need to be done if you're able to access that information through the person's record. So I'll just take a breath because I think I'm speaking a million miles an hour. I've had a hectic day. And then we'll go through how to get connected and start using. So there is the way that providers access My Health record in terms of viewing, that can be via the hospital applications. And as I said, often those applications will actually have that similar look to what I just showed you in the demo, or through conformance software. Or a final option for viewing is through what's called the National Provider Portal. So if you have a look at the list of softwares and find that the software that you use, or that you don't use any software, but you still want to be able to access a person's My Health record, there is an option that gives you viewing access, and that's called the National Provider Portal, and that allows you to at least see the information. You can't upload through the portal, but you can at least view. And then, as I said, there is the uploading, as I said, via hospital applications. That tends to happen in the background, default to send through the discharge summaries for a hospital stay. But also some hospitals are now uploading other documents, including some specialist letters from outpatient clinics. And as I said, you can also have that happening through your conformance software, depending which software products you use. Check with your software vendor whether they integrate with My Health record. Patients themselves can view their own My Health record by logging on through the MyGov portal. They can also access it and look at it through authorised apps, mobile apps, and they can upload, as I said, that's patient-specific information through the portal as well. There is also work being done on a agency-branded My Health app, which will be coming soon. So one of the things that the Digital Health Agency has been doing over the last couple of years is working with software providers to build in that integration with My Health record and to make it easier for it to work seamlessly for you as specialists. And so you can see here there's a list that are currently in release. Others are currently in testing, and others are about to go live. They're in development process as we speak. So if you can't see yours on the list here, don't despair. They may still have some viewing ability for My Health Record, but these are the ones that are working towards that integration of uploading of specialist letters. The great thing about these software products that have done that integration is that they do allow access and viewing of all the documents and overviews that I've just mentioned. And as I said, that easy uploading of your specialist letters as part of your regular workflow. They can also upload copies of prescriptions that you write, and also enable non-clinical staff who are authorised by your organisation, so covered by the organisation's policy, to actually view and collate that information together for you. So, for instance, if you have a practice manager who's been through appropriate training, knows how to use the system, understands privacy and so on, then they can be authorised to open and access that information and provide it to you if needed. And likewise, they can finalise that uploading of specialist letters if you, for instance, use the dictation process. Key things that you need to consider if you are in private practice and looking to get connected to use the system is, of course, to make sure that you have a My Health Records security and access policy in place. There are sample templates available on the web link that Angela will be sharing with you. You also then need to go through a process of getting registered and connected to use the system. So you have to actually put in an application. You have to be working in a registered organisation. We do have guidance and another link that will be sent out in the follow-up email to guide you through all of that. And also you can call out to the PHN for support in that role as well, getting you connected and ready to use. Once you've registered your organisation, you'll need to contact your software provider and get them to configure your software and get it all set up appropriately. Ensure your staff are trained in using the system, and we can help in that space as well. Confirm how you're going to authorise staff and make sure that you're meeting your ongoing participation obligations, which are all spelt out on that webpage that we'll be sending out later. We do, as I said, have connection support available, registration support, so that you can get started and hopefully get started quickly to use the system. We do have a specific connections team at the agency who can support you through that registration process. They can be contacted through that email or that phone number and ask for the specialist connections team. As I mentioned as well, you can contact your primary health network and request support. So if you're in Eastern Melbourne PHN, there are contact details on the screen. Otherwise, we've got a link to a PHN locator, so you can find out who your PHN in your area is if you don't already know. And as mentioned earlier, if you are working in the hospital system, find out how to access My Health Record through your hospital applications. Chances are it may already be switched on. Ask your clinical informatics manager or quality manager. They should be able to point you towards the relevant icon in the system, or check your local intranet for information about how to view. So in terms of other useful resources, as I mentioned, we are running virtual classroom sessions where you can find out how to view those documents and many more, and how to use the systems across a range of the different software products. We also have sessions specifically for hospital staff and also for practice managers around practical tips around that background policy and compliance requirements that are in place as part of using the system. So they're all available through those links. And I think I've raced through my presentation, but I'm now ready to answer any questions.
Thanks, Kathy. We have had a couple of questions pop up. So we did have one question from Sean asking, where do we go to sign up for a virtual classroom for medical director? So I think you just answered that in the last slide there. So
yeah, that would be that link there.
They're fantastic. So obviously everyone will receive this, this presentation, so they could actually click on those links there that's relevant to their software. Tamara also mentioned that ZMed also has an icon that indicates if a patient has a My Health Record. So she was obviously calling out the green icon that's available. So it was just a comment to your presentation there.
The icon can vary depending on which software product as well. So, you know, just learn which icon is relevant in your product. ZMed have also just got a really exciting new release about to come live. So keep an eye out for that if you are a ZMed user. If you upgrade to their newest version, you'll actually be presented with a lot of the My Health Record information straight into your clinical screen for your patients rather than even having to click on an icon. So that's a nice development as well.
Fantastic. And we've got another one from Sean. Is there any way to access a patient medication past history in a format that can be imported into our clinical software? A number of referrals we get can be pages and can take a lot of time to enter into manually by admin and nurses.
Yeah, that's a good point. So at the moment, no, as far as I know, it can't just seamlessly get integrated into your existing software. But as I said, that medications overview screen that I showed you would give you the most complete information from across the person's My Health Record. Of course, you still need to use your due clinical judgment when looking at that list of medicines, because while someone may have been prescribed something, they may not necessarily have ever got that prescription filled, and you still need to ask whether they're actually taking it still. But unfortunately, it doesn't automatically populate into your clinical systems at this stage. Although, as I mentioned, there are some things happening, exciting things happening with some of the software vendors making some changes to how their product fits with My Health Record and integrates that information. So at this stage, it would be a matter of saving that medicines list or transcribing it into your product, unfortunately.
Another one from Peter. I think it's more of a comment than a question. Peter mentioned, I've been using this in Genie since the start of the year. However, I found very few patients have information in their My Health Record, and a few public hospitals are uploading discharge summaries. So obviously we're seeing an increase in change there over time, but it's taking time still, isn't it, Kathy?
Yeah, it really varies from state to state. Different jurisdictions have adopted at different times. So depending where you are and where your patient's coming from depends on how much information you find. Also, if you're seeing someone who's been relatively well, it's only as they interact with the healthcare system that information will go into their My Health Record. So if they have been reasonably well, you won't find that much in their My Health Record initially. It will perhaps have some Medicare information or their immunisation history, hopefully, but that might be it. But as they interact more with the healthcare system, or if they're in and out of different parts of the healthcare settings, then that information should flow in. And as Angela and I both said, those connections are really coming to the fore now. So I don't know what the stats are like for Victoria. Angela, you're probably more across it in terms of hospital connections, but there is again a list on our website which has all of the different hospitals that are currently uploading to the system, and that is ever expanding.
That's right. And there's an opportunity as well to obviously speak to your patients and encourage them to ask providers to start uploading as well, isn't there?
Of course, yeah.
That's right. One from Alison. Did I understand correctly that pathology results only appear on My Health Record 7 days after they are collected? So I think just reconfirming what you were saying before, Kathy.
So no, that's not actually right. So it's as the result or report is finalised, then it is uploaded to My Health Record, and it's immediately available to you if you're a healthcare professional to be able to see that information through the person's My Health Record. Any healthcare professional, as long as you're providing healthcare to that person, can see that result. But it is a 7-day delay before the patient can view that report through their own My Health Record. So they actually see it listed in their document list as a finalised report. They have a little lock icon on it because they can't unlock it for that 7 days. Once it's available, that will change and they can just click on the link and see the report.
Tamara, you've just asked about accessing the links on Kathy's slide. It's when we email that out to you that you'll be able to click on those links. So just wait for the email to come to you in the next day or two, and you'll be able to click on the links to the clinical software simulations relevant to you.
If you do want to jump on before then, you can go to the digitalhealth.gov.au webpage and look at the newsroom events and webinars, and they're all listed in there, the upcoming classroom sessions.
Yeah. Another one from Tamara. Tamara's been busy on the chat. Thanks, Tamara. We've just started using this week My Health Record on ZMed and have been amazed with how much information results, discharge summaries are available compared to 2 years ago when it was a dead zone. So
yay, that's great to hear. Lovely.
Yeah.
Excellent. That's what we like to hear.
Another question, can admin and non-clinical staff upload to My Health Record from ZMed who could not previously?
So with the new version, that should be enabled. So that was part of that round of industry offer that we had, was that they were going to enable that. So yes, you should be able to do that as long as you're covered by your local practice policy to be able to be authorised to do so. Then yes, that should be possible with the new version.
Thanks, Kathy. That's it for all the questions. I'd like to also say that we are sending out a newsletter in the next couple of weeks, which actually will have links to a lot of these resources that you've been talking about. So we'll ensure that everyone that's here on this webinar tonight receives that as well. So thanks, Kathy. I'm actually going to pass over to Eric now, who's our next presenter.
Oh, well, hi. Thank you. It's nice to be coming on a bit earlier. That's great. I'll just share my screen. So hi, everyone. My name is Eric Dunn, and I'm the presenter for this section on E-Referrals. Just need to move a couple of things around on my screen. I also would like to begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples who may be on the call this evening. A quick bit about me. I've been in information technology for over 20 years, the last 8 in digital health, most recently 4 years as the digital health manager at the Sydney North Health Network. I now help specialists and GPs with E-Referrals at SR. Tonight, we're going to talk about the existing referral process, how we've collaborated with other businesses to make the e-referral process easy, why use SR referral, why you're probably already live with SR referral and how easy it is to get set up if you're not. Then a quick demonstration on SR referrals in Genie and a demonstration for those that don't have Genie. And finally, how we can help and an opportunity to get your questions answered. So by the existing referral process, I'm talking about letters, faxes, and emails. There are potential problems with the handover of patient data, like did the whole fax go through with all the attachments? Did it go to the right person? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices, attaching scanned documentation to patient information in the clinical system, following up that the referral has been received, and retyping patient information. Referrals that go to a practice where a specialist no longer works will mean extra time following up and sending it to the correct practice, or contacting and finding another specialist for the patient. I've had clinicians express to me their frustration with the time spent on administration, not to mention the frustrations of the administration staff themselves. GPs and specialists have had secure messaging systems for years. So why no e-referrals? Well, possibly because there are multiple directories. Each hospital has its own directory. There are paper directories and online directories. There are multiple secure messaging providers. Specialists also move around between hospitals and practices. GPs have multiple templates for different systems, out-of-date templates. And you have to know all of this before you even start an e-referral. So there's no confidence in the system. It's easier to just send it by fax and deal with the fallout from that. So what have we done about it? Servant Media have collaborated with HealthLink to provide an end-to-end solution for e-referrals called SR Specialist and Referrals. I'm sure you all know about the Medical Specialists Directory, but if not, it started in Australia in 2000, and it now has a listing for every specialist in Tasmania, Victoria, New South Wales, and the ACT. It is curated so every entry is validated and up to date. It's available to you at no cost. And if you don't have one and want one, let me know and I'll send you one. SR Specialists and Referrals is the electronic version of the Medical Specialists Directory that is integrated into Medical Director, Best Practice, Genie, and other clinical software, with more coming all the time. HealthLink provides a secure messaging service widely used by most general practices and specialists. All specialists with a HealthLink EDI, that's an address, can receive SR E-Referrals. It is free for specialists to register for an EDI address. And HealthLink have created smart forms and integrated them into the clinical software to make the referral and data transfer process easy and secure. Using smart forms is becoming an everyday activity for GPs, and they're currently available for hospital referrals, My Aged Care, Fitness to Drive, and SR, with more to come. So why SR referrals? Well, we've streamlined the e-referral process end to end. With faxes, the GP rarely sends the fax. It goes to the admin staff. With SR, the GP sends the referral directly from their clinical software. It's instant, and the patient can be given the specialist's information on the spot. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. For GPs, they only need to look up one directory for all specialists because it's always up to date and identifies the referral pathways. There is one template for all referrals, regardless of whether they're electronic or manual, that is print or fax. It meets the requirements for GP accreditation and EPIP, and they can provide the patient with information on the specialist via email or print. For specialists, less printing, scanning, and data entry. The referral is received instantly. It's easier to find. There's more information on the patient, which can automatically be imported into your software. As for the directory, it's easy to update your information on the directory, and the GP will see your updated information immediately. There is much more that we're going to show you in the presentation. So how to get set up? Well, you're probably already live with SR. If you have HealthLink and Genie, you are live for SR. Ask your staff to check the incoming letters in Genie. Check out your details in SR and let us know if you have any updates, or just contact us for support and training. If you have HealthLink and other software, and your software is compatible with HealthLink Smart Forms, then you are live for e-referrals. In that case, just contact us for support and training. If you don't have HealthLink, register for a free HealthLink EDI address. If you're on compatible software, then HealthLink will remote in to set up your messaging. If you're not on compatible software, then you can be set up with a portal account, which we will show you in a minute. Once your HealthLink account is set up, we will turn on your SR e-referrals. So let's see how easy it is to use SR. Standing by online, we have Nicole, our resident Genie specialist, and Carmel to help answer questions and to show us how to check your details in SR, find referrals in incoming letters, search for referrals by patient name, link a referral to an existing patient, create a new patient and link the referral, and on-refer patients using SR and check the delivery status of referrals you have sent. And they will also show us how the HealthLink portal works, how to log in, view and save referrals, search for referrals by patient, name, and how to check your details in SR. So I'm now going to hand over to you, Nicole. Are you there?
Hello, hi. Can you guys see me? No.
Not yet.
There we go.
There we
Hello,
go.
hi. So I'm Nicole and this is Carmel, and we're just going to run through using SR in Genie software. So I'm going to share my screen. There we go. Okay, so what we're going to do is we're going to start off in a patient record, because obviously if you need to make a referral, you have to be in a patient record. So to find HealthLink, we go Tools, HealthLink Online, and then New. And this brings us to the HealthLink landing page with all the smart forms that the GPs use on a day-to-day basis. We're over here, the SR in red, and you click on Private Specialists and Referrals. Okay, so here we are, a picture of the medical specialist directory Eric was talking about. And the search functionality here is a way of searching the medical specialist directory electronically. So to start off with, I am going to select a category. I'm going to do a broad category. Let's go for neurology and search. Now here you can see we've got a group that's come up and some specialists that have come up with a mixture of e-refer and manual refer. Okay, this group over here does not have a referral button at the top there. So let's click on that group page and you can see more information about the group, and then you can choose which specialist to refer to. And there's a bit more information below each specialist to help you make that decision. But I'm going to go back to my search results and refine by location because there are just too many results over here. So let's type in a suburb. Bandura, and I'm going to search again. And now I've got my results been refined to just 6 specialists who work in Bandura. So I choose the specialist I'd like. And what I would be doing is choosing a location to make that referral to. I'm not going to do that now because this is live and I don't want to send a referral to the specialist. That would be a bit of a strange one. So let's do another search. And while I am searching, I just want to say that even though you as a specialist might not want to be making a referral today or soon, it's always good to have a look to see how you are represented on SR, because what you see here is what the GP see and other specialists see when they use SR. So let's do another category. I'm going to choose cardiology and search. Again, lots of results in cardiology, but in this case, I'm going to choose a subcategory, pediatric cardiology. I click there and down to 15 results, again, with a mixture of e-refer and manual refer. Now, a manual referral is exactly the same as an electronic referral. I just have to print it out and fax it at the end instead of it being sent by HealthLink, but the same process. To get these results, I could go along, I could do a search, do the same search, but a different way. So here we go, search. I'm going to select pediatrics this time. There we go. And search specialists. And I've got my subcategories, pediatric cardiology. There we go. What I could also do is search by keyword. And instead of doing a category and a location, I just start typing and I get some drop downs, pediatric cardiology. And there we go. Same results. So there are various ways of getting or finding the specialists if you don't know who to refer to. And a lot of specialists have more information on their page to help you make a decision as to who to send to. But I'm going to show you what to do if you do know the specialist's name. So if you know the specialist's name, the easiest thing to do is just type it in, and surname is best because there are shortenings of first names and nicknames. So our test specialist is Mickey Mouse. I'm going to choose him and search. Now, here we go, Mickey Mouse. I have got a few addresses for Mickey Mouse, one manual refer and some e-refer addresses. Now I'm going to choose the address I want, click on that address, and this brings us to the SR smart form. So this smart form is similar to other HealthLink smart forms in that the information is pulled through, a lot of the patient information is pulled through from the patient record. But at the top here, we have the specialist details, and this is pulled through from our database. So this is the medical specialist directory database. So again, it's a good reason to keep your contacts up to date. Below that, we have some information that the GP or specialist needs to fill in. A specialist referral would be 3 months, and a reason for patient referral is absolutely essential. You can browse consultation notes as well, but the referral won't be sent without these red star bits being filled in. So next, I am going to attach some attachments. So there's 2 ways I can do this. The first one, I can choose an attachment in the patient record. Here I'm going to choose the iron studies, and I'm going to attach. Really easy. If I'm not sure I've got the correct attachments, I can do a quick preview. And there you go. I know I've got the correct attachment. I can also look on my computer for any documents that haven't been attached to the patient record yet. So let's go browse. I've got my X-ray, open and upload. So that's been done. The next 3 sections, most of the information all pulls through from the patient record, and you can choose what you want to be shown, or you can remove things that you don't think need to be shown. The patient details all here, again, from the patient record in your software. The last section over here, the referrer information, that pulls through from your software. So I'm the person who's sending this referral. This is the information that's been uploaded to my software. So what I'm going to do now is I'm going to submit this referral. Now, I sent this referral to my portal account, and we will have a look at that in a few minutes. But firstly, I want to talk about this letter. So the referral letter is really clear. You can see it is all here neatly laid out, and it does mention the attachments at the bottom. I've also got the SR number over here, which is a referral ID. This is unique for each referral. And it's good to, sometimes we use that referral if we can't, to help track a referral that has been sent, especially if we don't have the patient name, because we at SR, we call the specialists all the time to check that they've got referrals, but we don't get any patient details. We work from the patient ID as well as the date and timestamp. So at the top here, we've got the note, referral sent and acknowledged, and with the date and timestamp. Now that means that HealthLink has taken that referral and is delivering it on your behalf. I could still print that referral out and give it to the patient, but it has been sent electronically and HealthLink does have it. Now that does not mean that a specialist or anybody has seen that referral. I'm going to close out and go back to here where we first came to HealthLink. Instead of hitting new for a new referral, I can see all the referrals that I have just sent. So this is the referral that I sent a couple minutes ago. Now I am based in New Zealand, so my time is slightly different to you. And you can see the form has been submitted. Now most of these referrals here say acknowledged, and that means that the referral was sent to the specialist software and the receiver's software sent back an acknowledgement. So we do know that those have been, they are in the referrer's or software. Not referrer software, the receiver software. Now I've got a few here that say form submitted. That usually means that we're still waiting for acknowledgement, but not all software acknowledges. So you don't be too worried about that. The main thing you need to look out for is if you see an error message. Unfortunately, I don't have one to show you. They are very rare, but they do sometimes happen. Sometimes the attachment is corrupt or something like that, and the referral does get show an error message over here. I've got one that's a bit unusual. If you see this over here, we've got a PO, and that means that this referral wasn't sent electronically. The form was made with HealthLink, but PO stands for print out, and if you view that referral, you can see that it was sent manually. So this referral is to be printed and sent by fax or email. It's the same process for whoever sends the referral, just that it has to be printed out at the end and sent by fax or email. So I'm going to close that. And so that is where you see all your referrals or all your HealthLink correspondence that has been sent from this patient record.
Just a quick note on that, GPs can check this log in their own software. They see this information, so they know when they've sent their referral and when it's been received at the specialist end. So that, yeah, that's really important that they can see that information as well. When Nicole referred a moment ago to the phoning, that's when we do the first time referrals go through. We're just checking to make sure that those referrals are being, that the training's happened and that specialists at the receiving end know where to look in their software. So we're providing proactive support around that.
Yeah, no problem. So that is how you send a referral and how to check on the status of your referrals that you have sent. So I'm going to close that because I'm guessing you want to know where to find your referrals. So finding referrals is really easy in Genie. You go to Open and Incoming Letters, and everything comes into Incoming Letters. So usually this will be set to the doctor's name, but we recommend setting it to all, because sometimes if there's a spelling difference in the name, the Genie will make a new folder, a new specialist folder, and they might get missed. So this way, if you set it to all referrals will come in. And this section here is unlinked. So unlinked referrals need to be actioned. And this is where you should be checking for all your unlinked correspondence. Pathology reports should be coming in here as well as discharge summaries, things like that. So let's click on that first referral. I've opened that first referral. There's the actual letter. You can see there. And you can see that Genie has matched it up to a patient in my database. So I've got the name there, David Anderson has been matched, and the date of birth and the Medicare number have been matched. So there's 3 equal signs over there. So because I'm very confident that this is the same David Anderson that is in my software, all I need to do is link. It makes a note that I've linked it, and it moves on to the next item in my incoming letters. So Genie has got my next referral, and I do not have a match on name here, or I don't have a match there. So I know I do not have this patient in my database. So what I'm going to do is I'm going to hit the plus sign with the man, and I'm going to make a new patient record from this referral letter. So there we go. I'm going to save that. And then I'm going to link this referral letter to that patient record. And again, Genie has moved on to the next letter in incoming letters. I'm going to close out of that and show you Donald Duck. Now, I know I have Donald Duck in my database because that is my test patient. I send lots and lots of Donald Duck referrals. So if I open this letter, I can see there's a match, Donald Duck, Medicare number, and date of birth. I would just need to link it over here, but if I go back to the patient record, and remember Donald Duck is my test patient, I've got my notification here. So Genie is telling me there is 1 unlinked letter for this patient. Now, this is where most practice staff find referrals. And I do get told pretty often that they can only accept referrals for patients that they have in their database. I'm just going to link this here. I'm going to click 1 unlinked letter. It takes me to exactly the same place, but it only shows referrals or letters for Donald Duck. So I click on that and link. There we go. There we are. So managing incoming letters is actually really important because, as I said, a lot of practice staff only see the referrals in the patient letter. But if you check incoming letters every day, you can see patient referrals for patients that aren't in your database. And that's a great way for getting new referrals. And with the way SR works, with GPs and other specialists being able to search by category and location, you will be getting referrals from GPs who've never referred you before. So it is important to check incoming letters. Do you have anything to say there? No. Okay, so you have now seen where your incoming letters come in and how to link them from the patient record. I do want to show you the portal. So there is that referral I sent a few minutes ago. I'm just going to log into my portal. Sorry. I need to bring this down a little bit. Oh, come on. Just need to bring it down. There we go, got it. Okay, so here's my portal. Now I have a portal account for doing demonstrations. So I log into my portal account, and the referral that we sent a few minutes ago is here. you can see the date and timestamp. So that was when we sent it. So I'm going to open that referral letter. And the reason I want to show you this is, again, just to show you that the specialist details are at the top here, all clearly laid out, the patient details, and then the referrer details. But what's really good about seeing the actual referral and not just the PDF is the attachments that I sent earlier show in the body of the referral. So that there's no separate attachments to download or look for or print separately. They're all in the patient record, and once this record, and they're now in the patient record if you're in Genie. So I'm just going to go back to the inbox. So my inbox is pretty full because I do send a lot of test referrals. But what you can do is you can search by patient name, and as a specialist, you can find that referral. And that's actually way easier than searching through a pile of faxes, even if the faxes are in alphabetical order. What I'd also like to show you is you can send smart forms from the portal as well. And here are some of the smart forms that GPs or you can use. And again, specialists and referrals. Now this shows exactly the same functionality as what we saw in Genie. The only difference is you will have to fill in all the patient details because there's no patient record to pull from. I'm just going to go back to Genie now. Are you good? Do you have anything to add? No? Okay, so to recap, if I want to send a referral, I go Tools, Health Link Online, New. This takes me to the HealthLink Smart Form landing page. I choose Private and Specialists and Referrals. And then you get to the search part. If I want to find my referrals, I go Open, Incoming Letters, and there are my referrals that haven't been actioned and need to be actioned. And the linked referrals show everything that I've already worked on. I'm just going to change the date order. So you can see the ones that we worked on earlier. And sorry, totally blanked out there. And this way you've got a referral, you've got a record of all referrals that have been sent, or all referrals that have been received, or all documents that have been received into your incoming letters. So ones that need to be actioned and ones that have already been actioned. And I think that's it. Can I put my screen share? Is there something you want to say? No, all good. Okay, so I'm going to stop screen sharing and we can take some questions.
Actually, thank you so much, Nicole. That was awesome. I'm just going to go back to my slides for a second. I think that's working. So did you, that was really amazing. Thank you so much for that. I really appreciate you doing that demonstration. And if you could stick around, well, Nicole and Tom will stick around for a minute and help me answer a few questions. Did you spot how to search for patients and create a new patient from the referral? That's got to be a major time saver. So you should be able to get into SR and check if your details are correct and if all the clinic locations are set up for E-Referrals. And I've got to get this working. And also, did you catch how easy it is to use the portal? And you can receive email notifications every time you are sent a referral, so you know when to log in and check for it. So whatever your workflow, if you're working with faxes, storing your referrals, or waiting until the patient calls, if you call patients to confirm, we can help you integrate SR into your workflow so you can reap the benefits of electronic referrals that work. We provide extensive free training for your staff and are happy to contact the GPs who refer to you so that they can use SR as well. So our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call us or email us with queries or for training. Let us know if you'd like email notifications set up for new referrals. And if you have a particular GP practice that you'd like to see shift from faxes to e-referrals, let us know and we can contact them and offer training. As for updates, if a specialist joins or leaves your clinic, or if you're changing your contact details, if you're adding or removing consult locations, and if you're doing telehealth consultations, please contact us and we can update your information anytime. Also, you can improve your profile. The basic entries are free. You can improve the quality of your referrals by including information on your services. You can include a photo and be found under multiple categories. Paid entries are annual and are a package entry. So you get into the medical specialist directory, SR and ozhealthpages.com.au. So thank you very much for your time. I'll hand back to Angela and see if there are any questions.
Thanks, Eric, Nicole and Carmel. We have had a couple of questions come through. Tamara has asked around if we can actually find a cardiologist within the directory. How do we go about doing that? You mentioned about being able to access the directory. So what's the best way of contact to do that, Eric?
Can I hand that one over to Carmel?
Do you want us to demonstrate finding cardiologists in SR?
It's if somebody wants to know if there is a cardiologist listed in SR and they haven't got access to it at the moment, how do they do that?
Oh, we can look it up here quickly. Do you want to see it live? Yeah, let's see.
So would you like the name of the cardiologist?
Let me just get my screens shared, and yes. Okay. I'm just going to new. May I get the name, please?
Dr. Nicholas Cox, COX.
Okay, I'm just going to type in Cox because that's easier than Nicholas. There we go, Nicholas Cox Cardiology, search specialists. And if I click on Nicholas Cox, I have got him at Victorian Cardiovascular Services with 3 locations.
There we go, Tamara. So if there is details there that need to be updated, how do they contact you to do that?
Our email, the ISA support email. So that'll be on the information that we send out. So
yep, fantastic.
Send an email or just phone us. Yeah.
Fantastic, thank you. Another question here from Kim. I'm a paediatrician who hears from GPs once or twice, but I'm more interested in referring and sending this info to allied health practitioners. Do you have any questions around that?
Yes, well, currently
we don't have allied health live at this stage. That may well come in the future. So we've Eric mentioned before, we've been providing this information for 30 years in New Zealand as well as in Australia. Our New Zealand service of SR is now opening up to allied health. So yeah, we're constantly evolving, and I'm sure we'll get to the point one day where we also have that information for allied health.
Fantastic, thank you. I think that's all the questions. I can't see any more coming through. Oh, hang on a second, there is a couple more. How well does HealthLink forms upload to ZMed? We are cardiologist specialists and have received cardiology referrals from HealthLink Specialist Record. We also perform diagnostic imaging on GP referrals, but have not received any referrals by this medium. So information in regards to obviously the functionality in ZMed.
Okay, so as far as receiving specialists and referrals, as far as receiving an SR referral, no problems in ZMed. You don't need a portal account, you just need a HealthLink EDI, which it sounds like you do have.
Yeah.
That makes sense?
Yes. Sorry, I was reading the other questions.
No, it's fine. I had to think of that, quite figure out the question. But yeah, ZMed's absolutely fine. Great to receive referrals into ZMed.
Fantastic. I think that's most of the questions here. If there's any others there that we've missed, we can go through, but I think that's most of them for now. Is there anything else that Eric and Nicole and Carmel that you wanted to present to anyone tonight?
Well, I would like to say to that practice who said they haven't received any electronic referrals, if they get hold of us, I can see what they look like on SR, show them what they look like on SR, but also we can contact their high referring GPs and speak to the GPs saying that they'd like to receive referrals by fax. And that's a great way for us to get in and promote SR to GPs. So please get hold of us. It makes everything easier.
Fantastic.
Similar to this training session, we are running ongoing training sessions with the GPs, and we've also had a presence when the conferences are happening. We've been at the conferences. Obviously, in the printed book that goes out, there's information about this service to GPs as well. So there's definitely a growing uptake of referrals coming through by GPs using this service. And yeah, we're really excited to be able to support it, and that's our key role. In New Zealand now, the bulk of electronic referrals are sent through SR. So we're on a pathway similar over here, which is really exciting. But it's a case of working together, matching up the GPs and specialists that want to send and receive electronic.
Thanks, Carmel. One last question. We have somebody asked, if my books are full, how do I tell referrers this? How can I notify this on your system?
So you can place a message on SR, and we do, often what we encourage people to do is to include information about exactly what their services are so that they don't get inappropriate referrals. When people retire, we often put a message up to say, rather than someone drop out of the system, we can actually put a message up saying that they're no longer taking referrals. So that is an option. We prefer to place a message than to delete people off, because then the GP thinks that the information is incomplete. So that's the way we normally handle changes of status like that.
Fantastic. Thanks, Carmel. I think that's all the questions. That's everything come through. Yep, so I've got to thank you. So I think that's it. Thank you. Well, thank you everyone for attending. Firstly, I'd like to thank Kathy from all the way over in WA, Eric, Northern New South Wales, and Nicole and Carmel from New Zealand. So we've had a broad scope today. I'd like to thank you all, also the attendees for attending tonight. We've got an earlier mark, so I'll let you get back to your evenings. Please, if you have any other questions that we haven't answered, please contact us on the email that we provided on the registration. But if you can please complete your survey as you finish up tonight for all feedback for us all. So we thank you, and good night to everyone. Thank you.
Thank you so much.
Good night.
Good night all.